Thank you very much, Martin Paul. I think it's great to see that we have two presentations that actually look at a similar sort of topic, but in different countries. I think that will be part of the conversation this morning. I encourage also our panelists to pose questions to one another if needed, and we're opening the floor to questions. So if you have a question for any of the panelists, please raise your hand. We have two roving mics. There's one there. Let's take about 2 or 3 questions, and then we allow those whose question it is to respond.
Yes, hello. Hi, I'm Richard from UNICEF. Innocenti, thank you all for your presentations. Very interesting to see. I actually had a couple of questions to some of the panel members. First one was for Marcos. You showed us that you used the difference in saturation in the villages as a measure of seeing how the community affects the psychological effects of the intervention. And I was wondering, just why was the saturation different across different villages? Does it have to do with the targeting of the program? Were there any rules of how the program was assigned to different households in different villages? Just to understand a little bit why that was different. And for Maria on the Ecuador study, very interesting to see such strong effects on stunting. That's very valuable. And my question was, it wasn't clear to me after how much time you measured your outcome, the stunting, like how much time has passed since they were in the program that you were measuring your Z-score, because we know that stunting, because it's kind of like a accumulated outcome over time, affected by continuous health issues or continuous poor diets, that it's more of like a accumulated measure of poor health. So usually short-term effects on stunting, they usually never materialize. So I was just wondering, what is the timing between being in the program and your outcome, if you can say a little bit about that. And I was also wondering if you have done any work, or if you plan to do a little bit more work on what pathways, what mechanisms are responsible for the effects that you are finding, because that could really help understand, how these programs affect stunting. Is it because people are better able to buy better food for children, or are they better able to take care of them in terms of their health? Are there any other pathways that are causing this effect? And yeah, and then on the Ghana study, it's always good. I worked a lot on that study, so it's always good to see the use of the data being used for additional analysis. So very good to see this study. Just wanted to mention that we're also doing another follow-up of the same sample after 7 years. So that might also be interesting to have a discussion on what that. What your findings mean also for the long-term follow-up in that study. But let me stop there and give the floor to others to ask questions. Thank you.
Thank you very much. Are there any other questions? Not for now. I would like to pose a question of my own to Shreya. I wondered whether your study was motivated by any discussion at government level, or maybe at various state level, on the extension of the pension age in India, because what we're seeing in a number of European countries, and it's quite a contested field, contested debate about pushing the retirement age because of labour concerns, and so I'm wondering whether your study is either motivated by, or maybe perhaps feeding into that discussion in India, or whether you're ahead of that discussion, it may come later. Let me ask each of the panelists to respond, and then we can take some more questions if there's time.
Hello. Okay. Yeah, thanks for the question, Richard. Yeah, so saturation varied because we imposed it that way as part of the study design, right? And a bit of the motivation there was just understanding actually these things, both in terms of economic spillovers and in terms of psychological spillovers, right? So one motivating question was, yeah, whether we would see, I don't know, increased competition when a lot of people were retreated in communities, and whether this actually ended up being beneficial or not in terms of outcomes, right? And then on the psychological side, it had to do with trying to see whether these psychological lessons that beneficiaries were gathering from the program were spreading. So is it enough to just treat a few households, and would then the knowledge just spread along the community or not, right? So I think those were kind of the motivations that we had for imposing these different coverage rates in different communities. And I think that, yeah, the results are pretty interesting in terms of what comes out. Yeah.
Yeah, thanks for that question, actually. So a lot of the motivation for the study, I mean, as we've been working through the data and sort of refining our question, we've seen a lot of debate on a lot of different states having debates about whether they should extend the retirement age, seeing protests. So very recently, the state of Kerala was trying to propose delaying increasing their retirement ages to 60, and then had to decide to withdraw that as recently as 2-3 days ago, because there's been protests from some of the younger population in the state, because delaying the retirement age has implications for their employment. So it's an ongoing debate, and there's also been changes to eligibility for pensions both at the national level and the state level. So we're hoping that with more newer rounds of pension data coming in, we'll be able to do more with actually seeing the effects of these changes as they happen in real time.
Thank you, Richard, for your question. Well, the data set we used it has information from June 2022 until July 2024. So in order to estimate this effect, what we do is to compare, using as a counterfactual the children, well, has beneficiaries, the children who didn't receive the cash transfer, but are very alike to those who did receive the cash transfer. So the method that we use them as a counterfactual to make the estimation. That is how we made it. And the bandwidth we used, it was of 5 in order to find that 0.27 average standard deviation estimation that I presented. I cannot remember your second question. Would you be so kind to remind me what else was it? The mechanisms. Okay. Okay. Well, there are studies that have shown that to increase income in families have this kind of results. We found a study of Familias en Acción in Colombia that has similar results. And something that we want to check on, that, as I say, this is an ongoing research, is to check on if it is the conditional or the unconditional component of the cash transfer, which has more impact on it. Has the conditional part is related with all these medical checkups, where mothers not only get the doctor to check the baby, but they are also informed of better habits, how to feed children better and so on. So that is something that we want to check on our research later on. I hope I answered your questions. Thank you.
Yeah, so I think mine is not a question, right? So but I just wanted to reflect on something, and it's good to meet you, Richard, and thanks for the great data in Ghana, and I'm happy to know that you're still planning kind of another panel after 7 years. And I think this is clearly important, and it really bodes well to some of the evidence we're finding, because if we have access to that data, it's really going to confirm some of these findings we are seeing now. Because if after 2 years we see that households are investing more in terms of livestock, they're increasing the ownership of various durable assets, they're increasing their savings, they are not engaging a lot into loans. Right, I think seeing that after 7 years would really enable us to say whether cash transfers are indeed productive in terms of sustained impacts, right? Because after the stop of the cash transfers, what happened? Do households turn back to business as usual? Do we find that these livestock are indeed becoming more productive? Leading to more livestock, engaging more in the market, selling this livestock, possibly buying more kinds of food products. And I think that is also important for the psychological aspects, to see whether these various psychological aspects we're seeing are sustained, right? Do we just see that because of cash transfers, households improve in terms of their agency, they are happy, and when the cash transfers end, then they become very unhappy and things go back. But also, why I think it's even more important is that it's going to be after the COVID shock, right? Because, one thing we noted a lot in our paper, even back in 2017, was this whole thing about inflation. So we're so concerned about it. And if we think about inflation as a financial shock, then one would even think of COVID as a more integrated shock, capturing different aspects of financing, health, and everything. So it will be important to see, as well, how COVID impacted or how COVID improved or kind of brought back such gains. So this is me also just campaigning for the data, and hopefully we can as well just confirm some of these findings. Thank you very much.
Sorry, maybe I can add another question. And Marcos, I would love you to comment on Martin Paul's study, because you have two different studies about cash transfers, and yours in Paraguay seems a lot less optimistic about the outcomes of not so much you yourself, but the results seem to suggest less optimism about the impact of cash transfers than the Ghana study did. Can you comment a little bit on why you think that might happen? And I might ask the same then also from you, whether you can kind of engage a little bit on why effects seem to differ quite significantly between countries.
Yeah. So a couple of things about that. I agree that the results might seem less optimistic with the entire psychological dimension being considered. I think it's valuable, though, to just add this data point, and I think it helps us change a little bit the framework that maybe in olden times we were used to seeing recipients of aid or of programs as passive recipients, but instead now focusing more on beneficiaries of programs as active economic agents with rich inner lives, right? So I think it's important to think about their psychology and how these changes might be affecting them. So that's a first thing that I wanted to just comment on. In terms of mechanisms that might be ongoing in my own context, I think that, again, there's this expectation that the program brings about livelihood transformation. And when disaggregating into the different little components of the questions that we were asking, we did notice some distress indicators going up of people just feeling like maybe their effort is not being as valued, or them having a harder time, going to bed, having restless sleep, things like that, right? So I think that could be consistent with maybe people just not being super satisfied with their results quite yet, right? So seeing definitely increased time investment, increased money investment into their business, and perhaps not seeing the outcomes that they're expecting quite yet. So that is an internal view of things, but there's also a social view of things where people may be comparing results with other people in the community, right? And also seeing gaps there. So there could be a matter of added effort not necessarily being translated into better outcomes quite yet, which I'm really interested to see in the end line what happens with that, right? So yeah, in terms of Martin's work, I did have a question for you actually, Martin. So in my particular program, we implemented the same bundle for everyone, right? So I was interested in you commenting on or expanding on the difference between the cash-only results versus the cash plus insurance results, and particularly with the psychological outcomes, because I noticed, for instance, that cash-only also increases some of the measures like satisfaction or agency, but then when you bring in the insurance, the others measures also change, like impatience and future orientation. So if you can just say a little bit what your reading is on that. Yeah, thanks.
Yeah, I think it's so let me start from a question to kind of think a little bit on some of the differences we're finding. So I think, the first difference is really the question you're asking, right? Cash transfers and then cash plus, right? Because then if one thinks of this conceptually, one could see that it's not just about cash, because if you take away the cash, how do you expect kind of an insurance or health insurance to kind of improve asset ownership, to increase livestock ownership, or even to improve psychological outcomes? And, one key way to think about is it's really that in many African countries, out-of-pocket payments, it's really large, right? And then, when you have an insurance, then you don't have to stress against, paying for every medical bill you get. What does that imply? That implies that, there is like a trade-off. You can use that to invest on different things, right? So the financial resources that could go into maybe a health scenario, in your household, you could use that resources to invest either in various productive activities, like I said, in livestock, right? But also, think of the fact that when you're sick, you're not a happy person, right? And it's not just that when you're sick, you're not a happy person. It's even when you don't have the resources to take care of yourself, right? So if you have an insurance, you don't stress. So think of yourself that now you're sick and you don't have insurance. So it kind of creates really multiple issues. So I think that is really the conceptual point of thinking about this. But unfortunately, we don't have the data to test all these different conceptual ideas. But I think that really that is the importance of this cash plus, right? It's not just about giving households cash, but then, it should be blended with other things. But also beyond the fact that cash is different from cash plus, I think it's really a question of context as well. And one thing we agree as researchers is that, context really matters. So the context in Ghana may not be the context in Paraguay, may not be the context in Ecuador. And I think even beyond that, it's also more fundamental. It's what is the baseline? Where are we starting from? Right, so it could be that in your context, even though we're talking about poor households, they're not really ultra poor, right? So then it takes time to kind of observe all these changes in behaviors, all these changes in outcomes. Whereas in the context of Ghana, this is really poor community, such that every little change matters. But also still thinking about context, one thing that comes to my mind when I think about cash transfers in Latin America is that, it's been there, right? In Africa, it's a new thing. It's coming, it's picking steam. But, in Latin America, it's been there, right? So it's also this kind of sustained effects over time, right? Do we observe that possibly the households in Ghana, this is the first time they're receiving a cash transfer, but maybe in your case, this is not the first time they are receiving, right? And, this is also something we observe talking about, saturation effects, right? You keep going to certain communities and you keep giving them different kinds of supports and interventions, and then you're expecting the changes to be the same as communities that are receiving these kinds of supports and intervention for the first time. So I think all of these are just some of the differences I could think of.
Thank you very much. That's really interesting, and I think those are very good points as well. The context and the baseline that you start from can be very, very different. Are there any other questions from our panel? There's a question there. Microphone's coming.
So my question goes to Dr. Martin Paul Tabe-Ojong. So I think it was a well-researched and insightful presentation on the Ghana study, and it's clear how much thought and effort went into it. So I have two questions. My first question is, how did the cost of providing health insurance compare to the outcomes it produced? Was it cost effective? And secondly, did access to cash and health insurance change power dynamics in households or communities, especially between men and women?
These are very interesting questions. So I think starting with the first one, in terms of the cost, kind of the cost-benefit analysis, I think that is something that is interesting, but we don't have the data to see, because, and I think that is always the question, policymakers are always asking themselves, right? How effective are these interventions? Are they even cost effective? So what we estimated was really, should I say, average impacts, really not taking into account any costing, looking at how the size of the transfers versus the impacts on these very productive aspects. But I think it's even very hard to do it in the context of the kind of data we are seeing. I think with RCTs it's always better then, because you're costing everything, and it makes it easier to get these kinds of costing. But honestly, I agree, this is something that we as researchers should be telling our policymakers more, right? How much these interventions really have a cost implication, and how much they really relate to the perceived and really seen benefits. In terms of the power dynamics, so like I said, LEAP was really targeted to women who were pregnant and with kids under 2. So it was really a very gender-sensitive kind of cash transfers. And in terms of improving on the dynamics and power dynamics in the community, if you notice, we have one variable there about social support, right? So we observed that it kind of imbibed kind of the community kind of spirit for most of these households. But I think this is more fundamental in terms of kind of how the whole intervention was carried out, right? So it was not like the mainstream proxy means testing that you just go to communities and run things. There was also a community targeting aspect of it. So it really targeted poor communities, but it involved leaders a lot. So and when you think of it involving leaders, then it kind of improves on the power dynamics. And thinking about this, I think for the first study, I also saw something about the impacts on the community. So I would also be happy to hear your thoughts on that. I cannot remember, but I thought I saw some impacts on community upbuilding and support from your study.
Yeah, so we're still teasing out the mechanisms there, but yeah, the main result that relates to communities is that when there's a higher share of beneficiaries, you see better outcomes for households, right? That could be manifesting through different kinds of mechanisms. Could be that there's good role models. Could be that there's just peer effects, or that there's social learning going on, or that there's collective empowerment in the communities, right? But I think it's also a bit context dependent, like you were saying, right? I think it also necessitates not everyone competing in the same industry, for instance, right? So yeah, I think there's still room to explore there exactly how communities are building up beneficiaries, and we have some theories in that regard. Yeah.
Maybe I can come in there as well. I was kind of wondering that as well about the community effect and how do you achieve that in larger urban centres versus kind of smaller communities. If you're, if you're looking at kind of size of the amount of the percent of people targeted, you obviously you achieve a higher saturation much quicker in a smaller community. And then how do you control for other variables like kind of the benefits of being in an urban centre rather than are you looking into that as well?
In terms of controlling for these factors, the saturation rates that we imposed, that was also randomized at the community level. So the idea is that we're hopefully dealing with that. So the randomization actually happened in 2 stages. First, we randomized at the community level the saturation rates, and then within each community, we randomized assignment to treatment. So hopefully that's covering some of those other factors there. But the point that you're bringing up on urban centers, I think is super valuable. There's not actually a lot of literature on graduation programs being done in urban populations as well, right? And these programs, again, are associated more strongly with, letting people buy a cow or letting people buy some animals so that they can use that to pull ahead. But in my context, there's definitely more of a diversity of business ventures that people invest in. But like what Martin was saying before, I think that can also speak to why my results might look different from maybe some other studies, right? Maybe the context is different in that regard. But yeah, just as a final point here that I wanted to make, I think that, even though the results might be discouraging on average, I think that the fact that community helps is a encouraging message, and that, like I said in my presentation, it's definitely actionable. So that's a good news. Yeah.
Okay, thank you very much. Are there any more questions? Audience, any questions from the panelists to one another?
I have a question for Marcos, actually, just based on something you said earlier about the induced stress being because there's pressure from maybe there's some social pressure when you're looking at other people do better. So I was just curious if you'd collected, I find that social learning aspect really interesting, and I guess it could go both ways. You're either pressurized because you see your peers doing well, or you learn from your peers when you see them doing well and incorporate some of the things they're doing for their business. So I was curious if you had some baseline measures of social connections, and for your inline, are you collecting something about, which peer did you learn something from, and which peers did you learn other things from to incorporate in your business? Just curious.
Yeah. The answer might be less interesting in that we wanted to collect more careful network data, but then it proved too difficult in terms of budget and in terms of logistics. So initially, I was hoping to have definitely more detailed network data. That was too expensive, and I tried to do a modified version where people just reported on some of these questions instead of having a full census. But then maybe culturally people didn't feel comfortable answering those questions, so we just ended up with nothing too insightful there. But I think for future work, definitely, as we veer more into thinking about community dynamics and how that interacts with these kind of underpoverty programs, teasing out the networks mechanism there is super important. Yeah.
I guess one other approach could be that there are new approaches where you use maybe partial network data based on if you have detailed demographic information, which you might have given the midline and now inline. You could use that to construct sort of these synthetic networks and then figure out implications. So yeah, I'm happy to chat further on that.
Great, thank you very much. I think this is all our questions, and thanks to all the panel members for the great discussion, and nice to have a bit of interaction between the panelists as well. I'm sure you agree that they deserve a round of applause, and thanks very much.